Hey guys, it's Dr. Adam with Atypical Aesthetics, and today we're going to be talking about the submental fat. We're going to double chin. We're going to talk about different treatments that can be done in that area, how we treat it, what are some of the things to look for, who's a good candidate, who's not. And to help me discuss this topic, we have Marla back with us.
Hi all.
Good to
Glad to
have
be
you back.
here. Yeah, thanks for having me.
So I know this is one area that you like to treat,
Yes.
and it's an area that a lot of people have a problem with, and many people aren't aware of all the different options that they can use. But it is an area that can be treated in a very simple, straightforward fashion, and the results can be great.
Absolutely. Yeah, there's, a difference between laxity and actual fat and adipose tissue in that area. So we have some treatments that help with laxity, and we have some treatments that help with actually dissolving and getting rid of the fat in that area. So usually what I like to start out with is cool sculpting. It's a treatment that actually freezes the fat, and your lymphatic system flushes it out over the course of about 4 to 6 weeks, and that to treat in the chin area, submental area, and to kind of debulk with that, and then we can go in and fine tune with some other modalities.
Awesome. And I do like this approach. I mean, again, everybody's different, but generally speaking, if you're going to treat both the laxity portion and the adipose tissue or the extra fat portion, usually makes sense for most people to start with the extra fat, get rid of that,
Yeah.
and then treat the laxity of the skin.
Yeah.
Another reason why that sequence makes sense is also because some of the fat treatments that we're going to talk about are much more long term, pretty much semi-permanent, like cool sculpting or Kyballa. So it's not something that you necessarily have to continue to keep up with as
To
long as
retreat.
you're exactly
Yeah.
as long as you're not your weight isn't changing significantly more. So that way you can kind of do that first and then just kind of treat the skin laxity after.
Absolutely, especially with cool sculpting and Kybella, it's a permanent fat reduction in that area. It's actually, killing off those fat cells. They're dying off, and so you don't have
That's
as many
not-
fat cells in that area. So it's kind of
Exactly.
interesting. Even if you were to maybe gain a little bit of weight back, it might kind of go in different areas and not so much back in the face area. But yeah, and then we can
Yeah.
treat with.
And we can
with
go a
other
little bit
modalities
more
for
into
relaxing.
details of that, but that is
Yeah.
interesting because when our weight increase, it's usually the fat cells kind of getting larger in size. But when you're doing something that's going to get rid of some of these extra cells, as you've mentioned, even if your weight increase, there's going to be less cells in that part. So you are, in a sense, like resistance, a little bit more resistant to the weight gain in that area specifically. Of
Yeah.
course, it can still change,
Yes. Yeah.
but relatively speaking, not to the same extent as the rest of your body would. You've talked a little bit about cool sculpting, and then you've mentioned Kyballa. And so Kyballa is an injectable. So cool sculpting is more of a machine that we apply to the area, and as you mentioned, it freezes the cells to death. Whereas Kyballa is deoxycholic acid, and it's an actual medication. The active ingredient is injected in that area, and that will also kill the cell via a different mechanism. But in the sense, the end result is the same, which is the cells are dead, and then your body kind of gets rid of the dead cells, and it looks better.
Absolutely. I've actually done Kybella personally. My chin wasn't the right candidate for cool sculpting, so we went in and kind of fine-tuned with Kybella, and I'm really happy with the results. I feel like it gave a really nice chiseled jawline. The downtime was a little bit different than with cool sculpting. There was a little bit of the swelling, we call it like bullfrogging effect underneath, but overall, I'm really happy with those results.
So why weren't you a good candidate for cool sculpting?
Yeah, so the way that the treatment works is we have these kind of stencils, and the machine has applicators that are certain sizes, and sometimes for female chin and jawline it's just a little too petite, and so the applicator didn't fit on me properly, just suction wise, so I wasn't a candidate to do cool sculpting under my chin, so that's why we transitioned and decided to do Kybella.
Gotcha.
Yeah.
Yeah, there has to be enough fat to suction, and sometimes when people don't have as much or the anatomy of their face, then we do Kyballa. And actually, you might need multiple treatments to get to the results you want with either treatment, because each time you do the treatment, you would lose a portion of it.
Yes.
But you might have to go back again to lose a little bit more. And I've actually seen it too, where people maybe initially have more, fat tissue in that area, adipose fat, or adipose cells, and then we will do cool sculpting because there is enough for that machine to suction it. But then as there's less, maybe there's still a little bit left that bothered them, but not enough for the machine, the cool sculpting to work, and then they can go in and do Kaibala.
And that's where that fine tuning really comes in with the Kaibala, and especially, you know, kind of going off label with it too, you can do it in certain areas where maybe the cool sculpting machine just doesn't quite suction well, you know, sometimes in the armpit area, sometimes in, we've gotten fancy with it over the years. So
it's a nice thing because you don't kind of like have to get married to one or the other. You can kind of mix and match. You can start with one and then kind of fine tune with other. And that's the thing about Kaibala, because you are injecting it. You can, as you mentioned, fine tuning is the right word. You know, you can go in small areas and just kind of inject exactly where you want it. It can be used, as you mentioned, in other areas of the body, even though the submental fat is probably the area where it's most used. But cool sculpting can also be used in different areas, right?
Yes, so we can do cool sculpting all over the body. Typically, we see people in for abdomen, flank, inner thighs, outer thighs, but it's definitely very popular for chin area. I feel like people come in and either it's chin or it's abdomen are kind of the two big areas that we cool sculpt.
Now, these are probably the two treatments that are most oftenly used in that area, but there are a couple other treatments, especially to help improve skin laxity. And that's where treatments like RF microneedling, can come in, and it can help like produce collagen, tighten the skin. There's radiofrequency treatments, like for example, New Era is a treatment there. And then there's a treatment, kind of like a newer treatment that's becoming more popular that I actually love, called Endo Lift. And that you can actually do a little bit of both. You can kind of target the fat cells in it, which makes it cool.
I've heard that it actually can help eliminate the fat cells. Can you explain a little bit more about that?
Yeah, so basically Endo Lift, it's a laser, but it's very different than kind of like, your typical IPL or laser hair removal, because you're actually kind of going with the probe underneath the skin, and you're firing from underneath the skin, and you can kind of control the energy, which is gonna control the temperature that you're getting the targeted tissue to. But basically, you can target the fat cells to help kind of reduce that, but you can also do it to tighten the skin, and it works really well for tightening and kind of. It's called Endo Lift because it has that lifting effect.
Kind of two birds with one stone there.
Exactly. I still don't think it's necessarily a replacement to cool sculpting or Kaibala, especially when there's a significant amount of adipose tissue there that you want to go after. I think it usually makes sense to go with the Kaibala or cool sculpting first, but there's just still a little bit left, and you want it to also tighten the skin at the same time. Then Endo Lift can be a great option.
Wonderful, debulking and then jumping into Endo Lift to address the laxity.
Absolutely.
Wonderful.
Another thing that I love about these treatments, besides, as we've mentioned, that pretty much the fat cells are gone, so it's not something that you have to kind of continue to keep up with, is that they're honestly, relatively speaking, very safe. Now, there are potential side effects with any treatment, but for the most part, most of the clients that we see tolerate it very well. There is a little bit of swelling, especially with the Kaibala initially, but that's temporary, and then it tends to go away. Sometimes the areas can be a little bit numb or a little bit tender. Honestly, with Kaibala, like the worst pain or discomfort is right after you do the treatment, like right as you're doing the treatment and right after. But when people go home, generally speaking, it's not like it's not very painful or anything like that. It might be a little tender.
The stingles is what we call it, and it kind of is this almost like prickly feeling, but it subsides, and then there's a little swelling, a little bit of discomfort. Sometimes that numb to the touch, but it all subsides within a week or so, and then the results are seen in 4 to 6 weeks later, and most of our patients are really happy with the results of that.
Why does it take so long to see the result? I mean, I shouldn't say so long. It's 4 to 6 weeks.
For cool sculpting, your body's actually lymphatic system is getting rid of the fat, so it's moving it through. So it's a process. It's definitely not an overnight result like some fillers are, or something that you can see immediately. So it's a journey with cool sculpting. So really about at that 4-week mark is when you're kind of looking in the mirror and you're like, okay, I do see something, and then really it's that 4 to 8 week mark is when you're really seeing those results.
Yeah, and it's actually a pretty similar process with the other treatments we've talked about, the Endo Lift and the Kybella, where it takes some time to see the results, but on the other hand, the results are long lasting. And with Endo Lift, again, just like with Kybella, cool sculpting, you want to be informed because there's a long list of potential side effects, but most of them are not common at all. But the kind of more common things that we see are going to be swelling, sometimes bruising. But these things tend to resolve on their own, and again, most of the clients that we've seen tend to tolerate it, very well, after they get through that initial swelling period.
Absolutely, and I always tell people with cool sculpting, it's not something to do right before you go on vacation. It's a journey, so you want to start it, more, mid-year, and then you're ready for summertime. But with any of these treatments, you want to make sure that you're giving yourself enough time to have that downtime, and then to be feeling your best before any sort of big event.
Yeah, and, if you wanted to look, your best for the summer, it's a good time to start. You don't wanna. If you come in the week before, you're not gonna necessarily see any big difference in a week, but for 3-4 months ahead, that's when you start to see a difference.
Yeah, that's why we're in our busiest season right now. I feel like everybody's getting prepared for summer, doing all their chemical peels and body contouring and skin tightening, all that fun stuff. So.
But then you'll still have it for the summer after, and the summer after.
Yes, and then it's long lasting. Wonderful.
Awesome.
So if somebody wants to come in and have their jawline snatched before summertime, what does that time frame, what does that timeline look like?
Yeah, I mean, I would start with, as you've mentioned, like the cool sculpting, the Kybella, that fat removal, fat reduction treatments as soon as possible, because that's what's gonna take the long time to see the results. And you might also need a couple treatment depending on how much fat.
Might need another treatment,
exactly.
That debulking period before we jump into
other stuff, to the fine tuning, because again, some people, if they don't have much, maybe one treatment is all they need, but if you have more, the more you have, the more treatments you might need. Now, even within the same treatment, we might be able to do more like vials of Kybella to kind of get a larger area, but you want to start with that part as soon as possible. Now, as you mentioned, there are other things that can be done, like, where you see more of an immediate result, like Botox or filler. And actually, Botox in that area is very common and very popular. Filler to kind of define the jawline is very popular. Exactly. But in an ideal world, you would do kind of the fat reduction first, because that will, the more excessive fat that you have here, the harder it's gonna be to define things with the filler. The more fillers you're gonna need to kind of keep that, you differentiate, your jawline and stuff. So the more you can get rid of that extra fat, kind of the easier it'll be usually for the provider to kind of work with fillers and kind of like snatch it even further. So start as soon as possible with the treatments that are going to take a long time to see results. And then after that, once you get closer to the, your goal, like let's say it's the summer, you can kind of add these last kind of fine tuning part, whether it's Botox or fillers or other treatments.
Those are like the cherry on top.
Exactly.
Perfect. So first you're going to come in, debulk with cool sculpting. Then if there needs to be any more fine tuning, possibly Kybella. Then if you need any sort of skin tightening, we have some different modalities: radiofrequency microneedling, Endo Lift, or we also have our new era skin tightening machine, and then possibly Botox and possibly a little jaw filler. Did I get that correct in the time?
Yeah, and again, everybody, depending on exactly what you're looking for, and always use a good skin cream, during that time, of course. I know how much you love, skincare products, and I do too. But that kind of would be the good, a good consequence. And, get a consultation with your provider just to kind of see, because, your specific case and what would be the best approach for you.
Yeah, each client is, going to need a different game plan, a different approach. You're so good in your consultations of really kind of breaking that down and what every client needs. So.
Exactly, yeah. Everybody's a little different, but that is honestly overall kind of the general, sequence that we do follow. Absolutely. Well, hopefully you guys found this helpful. Leave a comment, subscribe, and like, and we'll see you guys next week.
Thank you so much for having me.